some slides. Okay. Hope you can mostly you can see the slides here. Okay. Right. Right. So ankle foot orthosis. So how the splint is look? First of all, वो आप लोग को हम show कर देते हैं. So this maybe look like something like this. Okay. So this is the static AFO. बिकॉज जो भी स्प्रिंटिंग हम बनाएंगे यहाँ पर वो थर्मोप्लास्टिक की स्प्रिंट्स नॉट वेट बेयरिंग स्प्रिंट्स होंगी एंड दैट वी कैन यूज फॉर द पोजिशनल ओनली और द पोजिशनल स्प्रिंट राइट because the thermoplastic sheet which we are going to use here is a 3.2 mm sheets only. Okay, so most of the pediatric cases you can use this splint, and this splinting is really very useful for the patient who has some contracture or some deformity in their leg. So I will show you the uses of this splint first of all, and then we'll go for how to make this splint. So use in the contracture, basically the contracture that is stretchable contracture. So okay, I have to admit some more person here. Okay, so use in the contracture and should be a stretchable contracture, just remember it. Okay, there are two type of contractures, stretchable and non-stretchable contracture. If the non-stretchable contracture is there, then it is not possible to use this splint over the patient. But if the stretchable is there, contracture is stretchable, then we can use this splint properly, right? And this can use for the proper positioning of the ankle and foot also, right? Use in pediatric cases and can be given to adult patient in ICU. So just remember, if the patient is stable and the patient is in ICU, is not walking, that time you can use this splint basically for the positioning of the leg or positioning of the foot, right? Use for joint protection. Yeah, if the patient is some patient has come those has some joint problem or has some joint deformity also, so that time we can use this splint also. Okay, and it is a static form only, as I told you, it is not a dynamic form, so you cannot use this splint for the walking. So if only for the positioning and for static purpose you can use this splint. No use for the dynamic purpose. Okay, so remember this printings are very useful for OT. What are the conditions there? So conditions may be cerebral palsy, foot drop, multiple sclerosis, and GBS patient. In all cases, you can use this splint, right? And either the patient is adult or the patient is pediatric. In both cases, you can use this splint only for the positional purpose, okay, not for the walking purpose or not for the gait purpose. Okay, so I will show you some splinting which we used in our clinic area. So this is the AFO which we used in pediatric cases who has some deformity in their leg, and foot drop is there also. So we use this splint and we'll get a proper positioning of the patient in their ankle area. Okay, so this is the splint which is made by our students who came here for the splinting course. So just you see there is a reinforcement at the back side of the splint. This is a black reinforcement. Okay, so this reinforcement is made by a aluminium strip, and as per the requirement, जितनी भी requirement होगी patient को, अगर सपोज करो पेशेंट के एंकल को हमें अप करना है या डाउन करने का है, तो फिर हम ये एंकल जो पीछे हमारा एंगल दिया गया है, इस एंगल से रिइंफोर्समेंट को हम पुश एंड पुल करके इसके एंगल को चेंज करेंगे, और एंगल को चेंज करने के बाद पेशेंट की जो प्रॉपर हमें पोजिशनिंग चाहिए उस पोजिशनिंग को हम यहाँ अचीव कर देंगे। सो रिइंफोर्समेंट डालना एक बहुत इंपॉर्टेंट पार्ट है। ड्यूरेशन कैसा रहेगा? स्प्रिंट को हम अप्लाई करेंगे 2 आवर्स के लिए, देन रिमूव फॉर 30 मिनट्स थ्रू आउट द डे। तो 30 मिनट्स आपको रिमूव करना है और 2 आवर्स के लिए पेशेंट को हम अप्लाई करते जाएंगे। यू हैव टू रिमेंबर कि ये स्पास्टिक कंडीशन है कि कॉन्ट्रेक्चर की कंडीशन है। अगर स्पास्टिक कंडीशन है देन टाइमिंग चेंज हो जाएगा, और अगर कॉन्ट्रेक्चर की कंडीशन है तब टाइमिंग हमारा चेंज हो जाएगा। ओके, so we have to remember कि sprint को कब use करना है, either in night or in morning time. So it's depend upon the patient condition कि condition क्या है पेशेंट की, contracture है, stiffness है या फिर spasticity है। ओके, spasticity जो होगी वो रात में रिमूव हो जाएगी, so रात में we do not require this sprinting अगर पेशेंट spastic का है। अगर पेशेंट contracture का है then we have to use this sprint at night condition. If the patient is the spastic condition, then we have to use this sprint in the morning condition, okay, morning times only. So this is very important areas. This is another case which we have to use the sprint, and we can see the before and after condition of the patient. So now the material which can use for the sprinting, that are the 3.2 mm LTTP, low temperature thermoplastic. Okay, aluminum reinforcement which we can use for the reinforcement or for the angle purpose. 3 mm Ethaflex we can use here for the padding purpose. 2 pairs of the 1-inch velcro which can use for the tie the belt or tie the splint. Resin strip we can use for the bordering purpose or for the edges, that is a half inches resin strip is sufficient for this purpose. Rivets we can use for the fixing of the that velcro, okay, and debuckles also. And belt we can use for giving a proper positioning of the ankle joint. Okay, one more thing which I want to discuss here or want to tell you, that this all material can be supplied by the sponsored by the Heritage Healthcare. This is the reliable and the economical source of the LTTP form. Rollins US brand this is, and contact information is there. I will give them mobile number and their email ID. If anyone want this, you can ask this person for material. Okay, now we'll move for the procedure. I will go for the procedure, and for the procedure purpose I will call my 2 student here, and I hand over this I make the host to one of the student, and they will start give a procedure. Okay, so first of all I will just stop to sharing the slide here. You have to wait. Okay, and I will make the host to Kunj. Okay, yes. So yes, Kunj. Yes, Kunj is there. So I make the Kunj as a host here, and now she can be. Wait. Make the presenter. Okay. कुंज आपका चालू है अपना दोनों, आपका वो ऑन करो, start your mic and as well as the photograph also. Wait.